Hi, I'm Dr. Kopala, chiropractor. I want to talk today about a very common condition we get in the clinic, but suffers too many people with this condition called plantar fasciitis. And I'm going to show you a couple key secret notes that we find in the clinic that works very successfully. We've probably heard of things like balls that we put down onto the ground and we just work through the bottom of the foot. That's where the plantar fascia is, the connective tissue that actually can get into damaged state and cause all sorts of pain and scarring and a lot of inflammation. So plantar fasciitis, especially if you wake up in the morning and your first few steps are agonizing into the bottom of your foot, very likely we'd have to rule out or rule in the diagnosis of plantar fasciitis. So a ball on the floor to dig through that bottom of the foot is a good idea. Massage therapy, acupuncture, those are all good ideas. The foam roller can be used as well, just to kind of dig through. Even if you don't have fancy stuff like this, just grab a bottle of Coke, one of those plastic bottles of Coke, fill it with water and freeze it. And so you get an ice while you're doing the trigger points at the bottom of the foot. But our number one go-to that I found that we don't even barely do this stuff anymore is using our Shockwave therapy machine. And this machine uses a special piston and a shock wave that actually goes into the bottom of the foot, and it hammers through and breaks down the scar tissue on the bottom of the plantar fascia and creating new blood vessel formation. And we've had phenomenal successes with this, and typically we see an 80 to 90% plus success rate after 3 to 6 visits, even with chronic condition where people have had the plantar fasciitis for months or sometimes even years. So that's something, if you have an interest in doing so, please call the Wellness Center staff and book that appointment. It is billable as a chiropractic office visit, so from an insurability point of view, it's actually good value, and we take care of that right in the clinic here. Thank you very much.